Good evening. Come on in. Welcome to your sleep study.
So we're here in the control room, and Dr. Wohlberg, why might someone be here?
So if someone is suspected to have a sleep disorder like sleep apnea, they are often referred for a sleep study where they'll be sleeping in a comfortable bedroom.
All right, so now we'll take you in to show you what it's like from a patient perspective. We have Julie, our volunteer patient today.
Danish, thank you for hosting us in this sleep center. This is a really interesting room. It's beautiful. Like, a lot of care clearly went into picking everything out. Can you tell us a little bit about your thought process here?
Absolutely. We wanted to have this not resemble like a surgical suite. Of course, we do medical grade testing here, but we wanted to resemble more of a home away from home environment. So we wanted to have very neutral tones, warmth. That's why there's so many brown notes here and yellows. It's to just get somebody nice and relaxed. At a glance, you can't really tell that it's a very sophisticated monitoring room.
So you mentioned that there's a lot of monitoring. It doesn't look like there's a lot of monitoring. Where is everything hidden?
Everything is built into these nightstands and just tucked away. And same thing for the ceiling. We went out of our way to make it, as you mentioned, hidden.
When I did my sleep study, I remember this beautiful room with these luxury sheets, but then I also remember a less pleasant part, which were I feel like I was pretty much wired from head to toe. Can you show us a little bit about what that's like?
Of course, of course. We like to keep everything stored away and hidden, so I'll pop it out. You probably remember, it was a collection of wires like this.
Yeah.
Quite a bit. Here's the box that everything connected into. And as you can see, there is a little tiny figure. Head to toe is really how you were wired.
Yeah.
And that's there because there's a variety of sensors. Sleep is different because Dr. Wohlberg will look at all of your different channels, meaning what's your heart doing, what's your lungs doing, what are your muscles doing across your jaw or your legs or your arms, and all of it tells him a story. So that's why it has to be at the top.
Yeah. Okay, how many rooms do you guys have here?
Well, we have 8 for adults and we have 4 for pediatric.
I think a lot of people probably are intimidated about the idea of having a sleep study, but you're really just kind of mimicking a hotel room.
Exactly. So would you like to take a look at everything we're studying here during a sleep study? Come on in, we'll show you.
So in the course of a sleep test, there's a tech monitoring 2 patients. He can see their brain activity, their breathing activity, their cardiac activity. He can visually see them. If they have an abnormal movement or behavior, they can document it. And ultimately, they can put together a report on what went on during their sleep. And we can ascertain whether or not there's a disorder that we can treat to make the patients have a better life and better health.